We are in the city of Cali, and we propose something different. We are going to explain what the Amore project consists of and why it is important. The project seeks to conduct dynamic evaluations of geographic accessibility to achieve health equity. Welcome to the Vinculo district in Buga to interview a patient who has had cancer, leukemia, and has needed treatment. We are going to investigate how his process has been and his access to health services. Follow us. Hello, Juan. How are you? Good. We have come to visit you because we want you to tell us about your cancer care process, how you were diagnosed, the treatments. Tell us a little bit.
Yes, ma'am. Yes. Well, for me, this new episode of my life has been a bit complex because, honestly, I never imagined, and it was far from my mind that this might happen someday. I always see it as something distant, like it's going to happen to someone else. One doesn't imagine this, doctor, because the truth is, you always see cases over there, like, oh, so-and-so has cancer, so-and-so has cancer, but you never imagine that it could happen to you. This episode has been very hard for me. Why? Because I have been a person who never, thanks to God in my life, had to go to a hospital or anything for illnesses or accidents. So it caught me, as the saying goes, with my hands tied.
How did you start to realize your diagnosis, and how was the treatment? Was the access to treatment quick?
Well, I had some bruises on my body, so I decided to make an appointment with my EPS, and I attended the appointment. That day, I worked as usual. It was a normal day for me. I worked and they gave me the appointment at 4 p.m. At that moment, I arrived at the health center and the doctor attended to me. She asked me to present my ID to get a test done. Immediately, they took a test, took me to the emergency room, and did a blood test. The doctor told me that my health was delicate and that I needed to stay hospitalized. Since I was in an urban area, the doctor said I had to wait because they needed to transfer me to a more complex hospital. So I was shocked, because, I even asked, well, is that really my test? Did he say to me, yes, you're Juan? I said yes, but I don't feel anything. Did he say no, you can't get up from here, what has happened to you?
We found low platelet counts, so the treatment and therapy began. And how was the access to go back and forth from your home to the clinic? How easy or difficult was it?
No, it was very complicated because the truth is I live far from where I need to go for treatments. It's about an hour and a half away. When there are no traffic jams. When there are traffic jams, the situation gets complicated. Sometimes it takes 2 hours, 2.5 hours. Many times, I have had to take the bus, and for an oncology patient, like those of us who suffer from this disease, it is very delicate. Why? Because one is a person who is immunosuppressed, who is a person that can catch any infection. Any infection. So, the most recommended thing that doctors tell you is that you should have your own transportation, practically not receive visitors, and be isolated from everyone because any flu can kill you, since we are people who have very low levels of platelets and defenses. So it has been very complicated. Many times I had to pay for a private car out of my own income, with what I could from my salary, with what my wife earned, to pay for a private car to be able to go to the appointment. Appointments that must be within 1 hour, because as you may know, you go to an appointment and if you arrive late, you miss the appointment. So it happens many times.
So, the illness is not only the psychological impact, the fear of dying, but also the economic impact, the expenses you have to incur to be able to transport yourself, have access to your therapies, to your care.
The truth is, it's complicated and very complex because it's not just about me, my daughter, my mom, my wife, and I all depend on it. So if I am the head of the household and I am in that situation, it affects you mentally and psychologically as well, because you think, besides thinking about your own health, you are thinking about them. Because you say, well, now there are many more expenses. And what do I do if I am stuck here, I am sick? So, in addition to that, as I was saying, using one's own remaining resources to cover those transportation costs.
Well, I wanted to ask you if the health promoting entity provides you with any support for transportation, or if you received help from someone to be able to get there.
As for the health service provider entity, no, but from the company where I work, they did help me with transportation. After the issue was socialized and everything, they saw that my transportation was necessary, and they arranged it with the Cerrito Fire Department. They managed the transportation for me, and thanks to God, I am very grateful to them for this service because it was very timely. As you can see, this is a rural area, and it is very difficult to say, I will go out there, because the car will pick me up or the bus will pass by. No, here the buses pass roughly every half hour. Every 45 minutes a bus passes. So if a person in delicate condition has to wait 45 minutes to be picked up, they will deteriorate while waiting.
Esperando ese descompenso. Nos encontramos con la doctora Lida Osorio, doctora en epidemiología, profesora de la Universidad del Valle en la ciudad de Cali. Doctora Lida, queremos que le presente a la audiencia qué quiere decir el término equidad. Cuando uno habla como investigador, ¿qué es equidad?
La equidad se refiere a esas diferencias que consideramos injustas, que no deberían existir.
We met with Dr. Lydia Osorio, a doctor in epidemiology and a professor at the University of Valle in the city of Cali. Dr. Lida, we would like you to explain to the audience what the term equity means when one speaks as a researcher. What is equity?
Equity refers to those differences that we consider unjust, which should not exist.
He has participated in several studies, but today we want to focus on the research by the Amore group, which has measured equity and access to health services. Tell us about that study and why it is so important methodologically for contributing to the planning of services.
Okay. The Amore project aims to provide evidence on how we are planning health services in urban areas, especially in those with traffic congestion problems, such as the city of Cali or Bogota or others in Latin America and the Caribbean. What we are observing is that the planning of health services, such as hemodialysis.
We are at the University of Valle in Cali, Colombia. We have come to interview two great experts, Dr. Maria Fernanda Tobar, a public health specialist, and Harvey Vivas, a researcher and professor at the University of Valle. We are going to interview them to learn their opinions on the matter.
I have participated in the Amore project because the Amore project truly aligns with the needs of health systems to understand what barriers to access the population faces in reaching care. We know that there are multiple categories of access barriers, but in terms of people actually being able to make the decision to seek a service, the issue of distances plays a determining role.
Well, the issue of socio-spatial segregation and residential segregation is closely linked to the opportunities that individuals have when they move within cities. And precisely, barriers to mobility constitute one of the most profound obstacles faced by, for example, the population with disabilities, those who have mobility issues, locomotor problems, or any type of disability within the city. But this intersects precisely with other characteristics. In the particular case of the city of Cali, it is that Cali is a city of high socio-spatial and residential segregation, skin color, due to conditions of vulnerability, poverty, quality of life, and of course, also due to disability. For example, in the hillside areas, a significant proportion of the poor population lies who are highly vulnerable, but it also combines with some population that has difficulties. Accessing employment centers, recreation centers, and of course, first, second, and third level hospitals, and all the services that the city offers. At the core of all this is the major issue of the right to the city. And in Cali, it is evident that for many population groups, those rights are restricted.
Hello, Dr. Alexander. Sorry, that's good.
Nice to meet you, Doctor. Welcome.
Today, we are meeting with Dr. Alexander Rodriguez, who is an occupational physician, an expert in labor law, and knowledgeable in many areas of business consulting for companies of all sizes, small, medium, and large. Welcome, Dr. Alexander. We would like you to tell us, based on your experience as a corporate physician, what happens and what is the impact when a worker has a high-cost illness, not just kidney failure requiring dialysis or cancer requiring chemotherapy and radiotherapy. What impact does it have on the patient and the company in your experience?
Well, thank you very much for the invitation to discuss these very interesting and important topics, because talking about pathologies, mainly cancer, mainly patients with renal insufficiency, generates a high impact, not only on the patient, their family and society, but also in the business sector. And it should be clarified that in Colombia, our social security system, although it has almost universal coverage, we sometimes encounter barriers to access for this type of patient. So, how could we address this, doctor? From different points of view. The first thing is that this worker, who has these types of pathologies, will see their quality of life diminished. That patient's quality of life will be reduced, and primarily one of the barriers to access we might face is the locations where they have to undergo therapy. One would wish that those places were much closer for the patient. And unfortunately, when we are in intermediate cities, we see that those places are much farther away from the patients. There are patients who have to travel 2, 3, or 4 hours just to get to their hemodialysis therapy, and those hemodialysis sessions can take between 3 and 4 hours. So, what are we going to find? A primary issue is the matter of workplace absenteeism. These patients will have to be absent for a long period of time. So, imagine yourselves, small businesses and large companies. Here in Colombia, 90% of companies are SMEs or micro SMEs, meaning we are talking about companies with fewer than 50 employees. And having these workers with this type of pathologies, where is that going to lead us? Well, simply their level of absenteeism is going to increase, especially with the issue of access barriers that we are going to have there at 2010. So, is that going to generate some clashes? Clashes between whom? Conflicts between the worker, the employer, and even their family unit. Now, when we face large companies, well, large companies have greater resources to be able to solidify and support that worker. Social work, the areas of occupational medicine, in other words, all these areas that will allow the company to support the worker, mainly for their commutes. Nevertheless, as I was saying, one of the major limitations is that in intermediate cities, hemodialysis sites or places to treat cancer are not as widespread, so people have to travel to the capital cities, Bogota, Medellin, Cali. So imagine a 3-hour journey just to get your hemodialysis, which can be 3 times a week. So it's 2 or 3 hours to get there, 2 or 3 hours to return, plus the 4 hours, since the person is in treatment all day, and in addition to that, they need to be accompanied by a family member. Being in the company of that family member, it creates an impact on their family unit. So, in companies, and as I was saying, in large companies, we have tried to provide support to these types of workers. Again, with social work, providing them with support from a financial standpoint. Until when? Until they complete their process of assessing the loss of work capacity, because that's another step that has to be done with them, right? They need to be guided so that these types of pathologies ultimately reach a process of assessing their loss of work capacity before the social security entities.